We are grateful for the invitation to present this overview of our study titled An Australian Real-World Study of Treatment Persistence of Ustekinumab in Crohn's Disease. Crohn's disease is a common, incurable inflammatory bowel disease. The aims of therapy are to treat acute disease, maintain remission and quality of life. Therefore, treatment persistence is key to achieving and maintaining good clinical outcomes. The Pharmaceutical Benefit Scheme is an Australian government program that provides subsidies for prescription medicines. Real-world data can be obtained through a 10% sample of PBS claims data made available for research by the Australian government. This dataset has been shown to be widely representative of the Australian population. In Australia, CD patients are eligible for subsidised biological therapy through the PBS after corticosteroids and immune suppressors. Ustekinumab is the most recently PBS subsidised biological therapy for severe CD, available since September 2017. The real-world studies in understanding the use of biologics in the Australian setting are very limited. Thus, our study aims to utilise a PBS 10% sample dataset to describe ustekinumab use and real-world persistence in severe CD patients from September 2017 to March 2020. Treatment persistence overall, by prior biologic experience, mono or combination therapy, sex and age were assessed. Of the 301 patients in the 10% sample, 59% were female and 77% were aged 26 to 65 years. Median follow-up from first ustekinumab dispensing was 16 months and median persistence to ustekinumab had not been reached. The overall 12-month persistence to ustekinumab was 83%, with 12-month persistence of 88% for biologic-naive patients and 81% for biologic-experienced patients. Males had significantly higher persistence to ustekinumab than females. Receiving ustekinumab as a monotherapy or in combination with other medications had no effect on persistence. In a Cox regression model, we also found males less likely to discontinue treatment. Age and prior use of biologic therapy were not significant in the model. Our study demonstrated that ustekinumab is associated with high levels of treatment persistence in a real-world cohort of patients and correlate with local observations that monotherapy with ustekinumab provide adequate clinical remission for most cases. Results are comparable with a small number of real-world studies of the persistence to biologics in CD from other jurisdictions. Although the results should be further validated in future studies, when taken together, the persistence rates observed in this study and the existing literature demonstrating a correlation between persisting on treatment and reduced disease activity support the usage of ustekinumab, resulting in good clinical and patient outcomes in Australia.